wanted to share with you my weekly routine as far as medication goes. As the number of meds and the number of kids have grown, I figured out a way to kind of streamline this process. So we use these containers for each of the kids to separate morning and afternoon or evening pills. And I've got everybody's meds grouped, and I'm getting ready to fill the containers. We store all of these medications in this big plastic bin, and it goes in our locked closet. We have to keep all of our meds locked. It's just the safest way. So as I begin, I go in here and I open all these containers. Some of the kids are on the same medication. We have all the kids on probiotics. They all take an iron supplement. We have kids that are on meds for thyroid. We have kids that are on allergy meds. Some are on asthma meds, medicine for seizures. You name it, we've got it. So we've got one child done, and moving on to the next one. And on each prescription bottle, it tells you the earliest refill date, and I always keep track of that, make sure that I'm calling the prescriptions in on time. And as I call them in, I actually take a picture of the bottle, so that way when I go to the pharmacy, I can pull out my phone and I know exactly which prescriptions I need to pick up. Otherwise, I cannot keep track of it. I am the one that's in charge of all the medicines. I'm usually the one that takes the kids to most of their doctor's appointments. Just with having a background in the medical field, it definitely helps out. So when it comes time to dosing out the pills for the kids, we use these little red disposable shot glasses. They actually are the perfect size. We put them out on the counter like this, go to the specific day, open it up, pour it in here, wham, bam, give this to the child with a drink, take their pills. Thankfully, they're all really good at swallowing pills, and we don't have an issue with that. But these are really helpful. Sometimes I'll write their names on them with a Sharpie if we have like a babysitter coming who needs to do meds. Then that way it keeps it all organized, and we know who's getting what meds. Daniel and I also take daily meds. However, we only take ours once a day. Now that all of the daily medicine containers are filled, they go over into this white bucket. This is our daily medicine container where we keep everybody's daily meds. There's some that we can't put in the daily meds because they either disintegrate or interfere with some of the other meds, and so we have to keep them in separate containers. And we've got, like our inhalers and whatnot in here as well. So this particular week, I don't have very many prescriptions to refill. I call the pharmacy. I follow the prompts on the phone, and then I would line these up so that I can see the names of the kids and the name of the medication. Boom, take a picture of it, and then it's stored in my phone, so when I go to the pharmacy to pick up meds, I know exactly who I'm picking up for, what medicines, if there's an issue, and I can deal with it right then and there. We had too many trips of coming home and finding out that we'd missed one medication and maybe they were waiting on an authorization or whatnot, so this is kind of my balance in check. watching. If you liked the video, make sure to click the like button or subscribe so you don't miss more videos. You can also follow us on Instagram or Twitter, or visit our blog, diverginglives.com.